So hi guys, we'll be continuing with cardiovascular physiology, and the next topic is receptors in the cardiovascular system. So first we need to understand what are receptors exactly. So receptors are molecules that would sense a stimulus and they would transmit those signals to a sensory nerve, and this would cause some kind of changes to occur in the body. The main receptors that we have in the cardiovascular system are baroreceptors and chemoreceptors. So on the top you can see baroreceptors and on the bottom you see chemoreceptors. So first, baroreceptors. So these are mechanoreceptors that would respond to changes in the length of the tissue. They have both a static and a dynamic component. The static component is associated with maintaining pressure levels, while the dynamic component is associated with phasic pressure changes. The next is arterial baroreceptors. So these are undifferentiated nerve fibers that are present in the layers of the arteries. So the tunica media and tunica adventitia of the carotid sinus and the aortic arch. So in the carotid sinus, since we know that receptors, they send their signals or their stimulus through a sensory nerve, the carotid sinus sends it through the glossopharyngeal nerve, while the aortic arch sends it through the vagus nerve. The next are cardiopulmonary baroreceptors. So these are volumoreceptors that would be located in the heart and pulmonary vessels, and they mainly act in regulating the volume of fluids in the body. So receptors in the atria, they would be activated if the atria is stretched or if there's tension in the atria. So we have two types of receptors in the atria. There are A receptors that are activated by atrial contraction, and there would be B receptors that are activated by stretch of the atria. Then there are chemoreceptors. So these chemoreceptors, they mainly detect changes in the level of carbon dioxide and oxygen, and carbon dioxide and oxygen eventually result in change in the pH. So chemoreceptors detect change in pH, and they can be divided into peripheral and central chemoreceptors. So central chemoreceptors are mainly medullary chemoreceptors in the brain, and peripheral chemoreceptors are arterial and cardiopulmonary chemoreceptors. So first are arterial chemoreceptors. They would be located in the aortic and carotid bodies. And if there's any kind of change in the pH or oxygen partial pressure, so they would send their stimulus to the respective nerve. So in case of carotid body, it's the glossopharyngeal nerve. And in the case of aortic arch, it's the vagus nerve. And there would be some kind of changes that would occur in the body. The next are cardiopulmonary chemoreceptors. They're located in the ventricles and they're sensitive to different kinds of drugs or pharmacological agents, but also some kind of endogenous peptides like endorphins that are produced in the body. They would regulate heart activity as well. The next are medullary chemoreceptors. So they are sensitive mainly to a decrease in pH or an increase in carbon dioxide. So if there's any kind of hemorrhage which causes inadequate perfusion to the brain, if there's increased levels of carbon monoxide or carbon dioxide in the plasma, or even hydrogen concentration, this would cause vasoconstriction in the body. So on the right, you can see peripheral chemoreceptors. They regulate the flow of blood by increasing blood pressure by regulating cardiac output, while central chemoreceptors, they stimulate vasoconstriction that regulates the blood pressure in the body. So this is it, and this is all you need to know from the point of view of exams. I hope you find this interesting and good luck for your exams as well. Thank you.